Content warning. The following case study includes themes of substance use, emotional instability, and personality disorders. It is shared for educational purposes only. This video is based on Drugs in Perspective by Richard Fields, Ph.D., and was created by Brandon Harmison using ChatGPT and NVIDIA AI. This is not legal or clinical advice but rather a tool for discussion, education, and awareness. In this chapter we examine a real-world example that captures the complexity of co-occurring personality disorders and substance abuse. Meet Diane and Rusty, two adults whose emotional entanglements and mental health struggles create a painful cycle of relapse and relational chaos. Diane is an attractive 39-year-old woman who has been through residential alcohol treatment twice. Unfortunately, both times she relapsed within 2 weeks of returning home. Her relapse patterns are tied directly to explosive conflicts with her boyfriend Rusty. Despite recommendations from professionals, Diane repeatedly returns to a toxic relationship dynamic: jealous rage, escalating arguments, even physical fights. Their pattern cycles between intense closeness and bitter separation. It's high drama, high conflict, and it prevents them from focusing on personal recovery. Rusty, 42, is a wealthy accountant. Diagnosed with narcissistic personality traits and a mood cycling disorder, Rusty begins dating a 27-year-old attorney after a major fight with Diane. When Diane learns about this, she relapses and shows up at Rusty's house intoxicated. He apologizes, says he still loves her, and they reconcile. Weeks later, Rusty admits he's still seeing the young attorney. Another cocaine binge, another fight, more separation, and yet, they always seem to find their way back to each other. Each reunion only deepens the dysfunction. Let's pause here for reflection. Can you explain this dramatic and chaotic cycle in terms of their personality traits and their substance use disorder? What treatment recommendations would you make for Diane? And for Rusty? Let us know your insights in the comments below. Diane exhibits traits common in borderline personality disorder: intense fear of abandonment, emotional volatility, and unstable relationships. Substance use becomes a coping mechanism. Rusty's narcissistic traits, need for admiration, lack of empathy, and manipulative behavior, further escalate the cycle. His mood swings and cocaine use only deepen the instability. For Diane, the recommended approaches are dialectical behavior therapy, trauma-informed relapse prevention, and programs that address co-occurring disorders. For Rusty, cognitive behavioral therapy, mood stabilization medication, and individualized substance use counseling are suggested. Both Diane and Rusty need, separation and boundaries in order to heal. Relationships like Diane and Rusty's really highlight the urgent need for trauma-informed, personality-specific substance use interventions. So what stood out to you most? Would you maybe handle this case differently? Drop your thoughts in the comments and help others learn through your perspective. Source: Drugs in Perspective by Richard Fields, Ph.D. This video was created by Brandon Harmison using ChatGPT and NVIDIA AI. For educational use only, this isn't legal or clinical advice.